Good day, my fellow homeopaths and students of homeopathy. Today I will be talking about this book. It's called The Student's Guide to Materia Medica for degree diploma students. That's a complete title. And it's by the very able doctor by the name of Dr. Renu Bandlish. It's another publication by Jain Publishers, the largest publishers of homeopathy books in India, based in India. So this is an extremely useful book on Materia Medica in the form of questions and answers which have appeared in examinations across a variety of homeopathy colleges in India. This book was put together by the very able Dr. Renu Bandlish, mainly for the purpose of examinations, in her own words, and also to help the students in their studies generally. It poses a variety of questions under a remedy, in that how a remedy is used in clinical and therapeutic situations, for instance, Allium cepa in coryza, as well as the mental emotionals, the physical generals, and the physical particular aspects of a remedy. I have the 1995 edition, but I think there is another edition from 2003, but it's mainly MCQs in that one. So let's just go through the book now. So we begin with the contents page. You can see it begins from Abratanum, and it's like so many remedies in here, and different aspects of these remedies discussed. Shall I just go zoom in a bit more? No, I think I'll keep it there. Here, Rumex, and then it goes all the way to Zincum Metallicum. And then in the end we have a list of miscellaneous questions, which we'll get to towards the end. So I'd like to just go through some of the remedies in the book. There's different aspects like the mental symptoms of aconite, Athusa, Sinapium. Of course, the remedies are come with full names, not just the first name or the abbreviation. Here's an example of the different questions in the Apis section of the book. For example, write down the mental symptoms of Apis, and then it's organized very, very well. For example, mentals, it begins with ailments from jealousy, fright, rage, vexation, and bad news, and then the modalities of what makes a patient worse mentally. For example, heat in a warm room. And then there's more questions. For example, indications of Apis in acute tonsillitis. Apis, of course, is a huge skin remedy. So when will you prescribe anasarca? Anasarca is basically a term used for generalized systemic edema, where clear watery fluid has infiltrated into the subcutaneous connective tissue. So that edema is presented with redness and burning, stinging pains, or it could even be painless. It's predominantly right-sided, and a thirstlessness is a marked characteristic of an Apis patient. And then you have puffiness under the eyes, in the hands, feet, this swelling in the uvula, which hangs like a bag of water, ascites with puffiness of the face. As you know, ascites is the accumulation of fluid, again, but in a cavity, usually the abdomen. Parts are sensitive to touch, tender and sore. Anasarca with scanty urine, it's hot and comes in drops, and so on and so forth. And describe renal symptoms of Apis. And then these these are similar questions, so they're just posed as under one question. So give indications of apis in acute nephritis, or write down the urinary symptoms of apis. And then, as you know, apis, both apis and helleborus are excellent meningitis remedies. Meningitis, as you know, is a cerebrospinal fever and is an inflammation of the membranes of the brain and the spinal cord. So they can both be used in the case of meningitis, but how are they similar and how are they different? So this book is brilliant for differentiating between remedies. For instance, they both have stupor and they both have numbness, mental numbness. But how is it different? For example, eyes are partly closed, eyes are partly open, which is really the same thing. But here you have a benumbed look, and here they're just staring into the distance. And you have muttering and delirium. There's no delirium in helleborus. There's fever, and then again the characteristic of thirstlessness in apis, but there is a lot of thirst in helleborus. So it's differentiating how this just minute details that you find out in your case taking about the patient, and then how you can apply either of those remedies. The skin is sore to touch. He's picking his lips and clothes and boring into his nose with his finger. Urine is scanty and suppressed. Also, he is scanty and suppressed. And then again, the modalities of apis. Describe the eruptive fever of apis. Here in the modalities, you can see this. The answer itself is so well organized. You have time modality, when the patient is more aggravated, how he is thermally. Is he a warm-blooded or a cold-blooded patient? Which side is most affected? And so on and so forth. And then I'll just keep moving forward. You have bismuth, borax, causticum, similarly discussed. And Eupatorium perfoliatum, the fever is really well known. It's an excellent remedy for fever, not just fever, but flu and cold. There's florac, again discussed. It's one of the acid remedies. State the important modalities along with the desires and aversions of fluoric acid. Give indications of fluoric acid in lachrymal fistula. Fluoric acid is a good remedy for lachrymal fistula. What is lachrymal fistula? So a fistula is basically an abnormal duct or passage from an abscess, cavity, or hollow organ to the body surface. It goes from an abscess to another hollow organ. In the case of lachrymal fistula, we see a fistula opening into a tear duct or the lacrimal sac. So how is it a good remedy? Discharge of pus, which excoriates the parts around. There is violent itching or inner canthus. Sensation is that of a wind blowing through the eyes. Of course, the symptoms of a condition are of the utmost importance to homeopaths. And with lacrimal fistula, you have an excessive watering of the eyes onto the face, which is a clinical condition. And that's what you're going to be treating the patient for. We'll keep moving forward. Gelsemium. Describe symptoms of gelsemium in a case of typhoid fever. As you know, gelsemium is a useful remedy in the early stages of fever, in the early stages of an illness. It's also quite useful when a flu condition turns into chronic fatigue, sort of just as you're about to come out of the flu, and there's a lot of weakness associated with that process, then gelsemium is an excellent remedy for that. Graphites, ipecac, creosotum, lacaninum, just a huge resource. Nature Mule. For example, describe the headache of Nature Mule. The headache of schoolgirls who are anemic, chlorotic. Headache begins with sunrise and goes off with sunset, beginning with blindness. Throbbing headaches from eye strain, associated with nausea and vomiting. What is chlorotic? It's from chlorosis, and it's a kind of anemia in young women where the skin can have a greenish pale tinge alongside menstrual disturbances, usually caused by reduced hemoglobin in the blood. Chlorosis can come with comitants such as lowered appetite, of course headaches, sleep is disturbed, nervousness, poor digestion, great debility, and menses are either suppressed. Then the headache is described as hammering, but better when they perspire, better when they go out into the open air, and after sleep, worse. There's a modality for Nature Mule between 10 and 11 a.m. Worse from noise, music, motion, light, and in the warm room. Headaches can come on periodically, such as with PMS or, just as they're coming out of menses and so on and so forth. We'll move forward. Phosphorus. Describe phosphorus. Describe the phosphorus patient in detail. So you have the constitution of phosphorus. Another excellent, I just did not go into that remedy, but another excellent aspect of this book is how they compare and contrast remedies. So when I was writing my case analysis and case studies, working towards my licentiate, we had to differentiate between anywhere from 3 to 10 different remedies. And this book was really helpful for that. So if both remedies, for example, colchicum and cocculus, have vomiting, how is the vomiting the same between them and how is it different? So here, for example, vomiting can come on from night watching, but here vomiting can come on from riding in a carriage or a boat or motion sickness. And there is another bit that I wanted to talk about. Yeah, here, for example, under the section of calcarea carbonicum, so differentiating between a calc carb child and a calc phos child. How are they different? Constitutionally, how are they different? They're quite different, actually, because the calc carb kid is described as fat, fair, and flabby. However, a calc phos child could be lean, thin. He can look emaciated. He can be a dark complexioned child. And then you have a craving for eggs, an aversion to meat, and there is a craving for meat here, and so on and so forth. Similarly, the calc carb child is compared to a chamomilla baby. So calc carb baby differentiated with a chamomilla baby. Perspiration, what is that like? It's cold perspiration in the case of calcarea carbonicum, whereas a chamomilla baby will perspire hot perspiration. Dentition is slow, is delayed in the calc carb baby. And then complaints come on because of dentition. For example, they get diarrhea at the time that their teeth are sprouting. So we'll just keep moving forward. Kali carbonicum, lachrymal, we've been through there. Sanguinaria, pulsatilla, huge constitutional remedy, especially for children. Symphytum, syphilinum, thuya. Why thuya is called the king of psychosis. Give the drug picture of thuya with its characteristic symptoms. The answer for that is thuya is called the king of psychosis because it has maximum symptoms and characteristics of a psychotic miasm. It's a good remedy for suppressed and maltreated gonorrhea. Thuya has fig warts, condylomata, and wart-like excrescences. No other remedy equals Thuya in psychotic diseases. What is a condylomata? It's a plural of condyloma, which is a wart, or it could be a wart-like growth or tumor, usually found near the anus or the pudendum of a female. And it's the most typical expression of the psychotic miasm. And excrescences, as you know, are any outgrowth, wart, or nodule or eruption from the surface of the skin. Constitution is adapted to the hydrogenoid constitution. What is hydrogenoid? It is one of three constitutions described by Edward von Growall. I'm sure I'm not pronouncing his name correctly, but there we have it. He described this constitution that corresponds to the psychotic miasm, characterized by excessive water in the tissues and blood, and extra sensitivity to coldness and dampness. And they're fleshy people with dark complexion, black hair, and lax muscles. Children can have light hair, the face is waxy and shiny. Ailments can come on from badly treated or suppressed gonorrhea, of course, but they can also have ill effects from vaccination or too much tea, coffee, tobacco, fats, and onions, where they've overindulged in those food items. After this, we come to the last section, which is miscellaneous questions. This is a brilliant section because it's like a quick fire round of ailments and the main remedies that come up for such ailments. For example, name the drug or drugs having the following characteristic symptoms. Diarrhea sets in due to apprehension nervousness. For example, when they get diarrhea because of being nervous, what are the two remedies that come up? Are arginate and gelsemium. And then we move forward. Let me see if I could zoom in a bit more. Yeah. So intolerance of milk, cannot bear milk in any form, Methuselah. Hemorrhagic diathesis, small wounds bleed easily and profusely. The blood is dark and does not coagulate, lachesis. An epileptic child with craving for chalk and indigestible things, calcarea carb and alumina, and so on and so forth. So these are just, here, I'll zoom out again. Quick fire round of ailments and the main remedies that come up for those symptoms. This is an excellent, excellent book. So we have, for example, in this question, name the drugs that are usually indicated in the following diseases. Give 3 leading indications of one of them under each disease. For example, influenza. So the remedies that come under influenza could be ars, al, bryonia, eupatorium, perv, gelsemium, nux vomica, and rhus tox. And then, well, this just cross-references back to question number 236, where eupatorium perf has been discussed in more detail. And again, for peptic ulcers, these are the remedies that come up. For dysentery, tonsillitis, pharyngitis is the inflammation of the pharynx and the associated tissues at the back of the throat and mouth. It's painful when they swallow, and there's soreness and redness associated with that. And helminthiasis, which is worms in the intestines, and the remedies that come up for that are cyna, natphos, Britannia, santonine. And then one specifically discussed and how that having worms in the intestines culminates in a patient. So constantly digging and boring at the nose, rubs the nose on the pillow, grinding of the teeth, extremely hungry, canine hunger, hungry soon after a full meal, abdomen hard and bloated, always sleeps on abdomen, and so on and so forth. So that was basically it. Small, not really a book review, but more like a book tour of the Student's Guide to Materia Medica, and an excellent resource I have turned to time and again for my own studies, and I'm sure many of you will find useful. Of course, this is available as a PDF online, but it's a totally different experience having a book and holding it in your hand and being able to turn to whichever page that you need to refer to, and cross-reference, go back and forth, which is not as easy to do when you're scrolling up and down. So that's it from me for today, and catch you next time. Thank you for listening. Bye now.